Happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick, did y'all miss me? I've been gone for a few weeks.
Welcome back. Where you been? In the ER?
I've been in the ER.
Yeah.
We've been working. We've been busy. Although the last couple of days we have seen a little bit of a dip in our numbers of patients admitted to the hospital with COVID, which is good. Less than 50% now of admitted patients have COVID, which is down from over 50%, which is good. We've seen a little bit of a let up over the past 2 days where I think we're moving patients through the ER more efficiently. Patients are getting beds. Mm-hmm. We're not boarding 5 or 6 ICU patients right now like we were a week or two ago. So, fingers crossed that we're kind of on the other side and going in the right direction.
What was the most difficult part about the surge so far that we saw in December and January in terms of operations in a hospital and logistics?
Yeah, I think the difficulty with COVID has been patients stay in the hospital for much longer than usual. Like a usual hospital stay ends up being about 5 days for a variety of different illnesses. And COVID patients seem to stay 10 days or more. And so you take these patients, we have 200 beds in our hospital. If everybody stays 5 days, we're getting patients through. That leaves open beds for new patients to come in. But if you have everybody that's now staying twice as long as they used to, those 200 beds fill up fast and there's no beds to put people in. So that's been difficult with this disease process itself in terms of managing the hospital.
And in terms of the population that you saw experiencing the highest mortality, so people that are dying from COVID, what type of demographics were those patients they carry?
Yeah, so they would be what you would think, which is over 65, the older population with comorbidities, especially diabetes and hypertension. The obese population, the overweight population seem to have more difficulty with oxygenation than others do. And so, that we've seen a lot of deaths from this. So now that LA County has been vaccinating over 65-year-old patients, people around the county, we're really hopeful that will significantly decrease the number of deaths and mortality that we have in our county and then in our state and hopefully our country. So I'm feeling pretty good that we're hopefully towards the other side of it. I think it's a little too soon to call for sure, but there's definitely some positive signs.
Do you feel like the hospital, the vibe, people are feeling more positive about it in terms of also just maybe the risk exposure now that we've got a lot of healthcare workers vaccinated too?
Mm-hmm. Yeah, I think personally, 100% of our doctors and PAs have gotten the vaccine, and then a lot of our hospital staff has gotten it as well. Everybody's been offered it. Mm-hmm. Not everybody has gotten vaccinated.
But it's pretty good. Some local hospitals here have reported 78-80%. People that have been offered it in the healthcare worker community have taken it. That's much higher than what a lot of kind of lay news has reported. And I think people were worried, well, why aren't the doctors and the nurses taking the vaccine? What do they know that we don't know? And that's why there's been this big push on social media for a lot of, healthcare workers, physicians, and nurses to show that they've gotten the vaccine and that they're doing well and that it's safe. Anytime you have a vaccination or a treatment protocol or operation of this magnitude, you're going to expose vulnerabilities and adverse reactions in some people.
We've both gotten it.
We've both gotten it.
Both doses.
Mm-hmm, did perfectly fine with them. But right now, the only contraindication to getting, relative contraindication even, to getting this vaccine is a history of anaphylaxis or a very severe allergic reaction to getting a vaccine or to any sort of medication really before. That doesn't even necessarily mean you don't get it. It just means that you get a longer observation period. And most people that even have just a history of allergies, up to a drug or any sort of seasonal or environmental allergies have been doing fine with this vaccine. So
we just gave vaccinations out a week ago at CSUN.
We were at CSUN Megapod, and they gave out that day. It was a 10-hour, but really they gave out vaccines, I guess, for 8 hours, 8:30 to 4:30. They estimated, what did they estimate, about 4,000?
4,000 vaccines that day, and you and I were actually giving the vaccines in people's arms. It was great.
It was awesome. It was really kind of the first day in a long time I felt really positive and optimistic during this pandemic, because people were so relieved and
there was
grateful.
a buzz. People were excited to get the vaccine,
Yeah.
and it was cool to see. And so we had some really nice interactions with the people getting it and us giving it. And I mean, it was cold and wet and rainy, but we got through it. Got a hot shower afterwards. It felt great.
Yeah.
And it was a nice day.
So a little update on where we are as far as LA County goes with our numbers. We're going in the right direction, as Dr. Bryan mentioned. We were at about 75 cases per 100,000 a couple of weeks ago. We're down to 50 cases per 100,000 this week. So we're going down in the right trend. Again, like he mentioned, it's a little early and you never know, but we think we've peaked, and a lot of the modeling the IHME puts out indicates that. And then now we think LA County may even have from this surge potentially some level of natural herd immunity out there in the community, up to maybe 25%. And then you add the vaccination effort on top of that. That's only going to help with herd immunity. As we start to develop, people are going to be more and more protected. So all those are good news. So hopefully these numbers will continue in that direction, and things will start to be, we'll allow to start operate, a little bit more normally in terms of getting our kids back to school. Our businesses will be allowed to open with modifications. The vaccine effort is just Herculean. I mean, it is an enormous effort. And what's hard about the U.S. healthcare system is that it is fragmented.
Yeah.
Right? I mean, for better or for worse, whatever you think about single payer systems or national health systems, they're, at least in this type of situation where every single person needs a vaccine that's over the age of 16 or 18, depending on what they're getting. You can, if you have a centralized system, you can make that happen. And we just don't have that type of system here.
California just put the rollout in the hands of Blue Shield, an
Right.
insurance company, which we have different feelings on.
Well, no, I think what was the difficult part about California was that every county had their own way of doing it, had their own guidelines. LA County completely flubbed the effort in terms of getting over 65 vaccinated, and they sort of dragged their feet, and then there was basically a shove in that direction to get people vaccinated, and it really confused a lot of people that the state is saying one thing and the county is saying another.
Right.
And now there's a lot of discussion about maybe that these guidelines will change even further, that they'll be more age-based and not as much occupational based. Maybe it won't be teachers or essential workers, maybe it will be just 50 and up, who knows. And it's an enormous procedure. When it is your time to get it, if you have the opportunity to get it, just get it.
Yeah.
Every person that's vaccinated contributes to the herd immunity that we will develop over time. So I'm here if you have questions. I don't necessarily have any more. I don't have an inside scoop as to when we're getting more doses or when things are going to roll out even more, but keep checking the website on LA County Department of Public Health.
Reminder, it's not a live virus, so you're not getting
Yes.
the virus. It's just mRNA making a protein that kind of looks like the virus so that your body makes immunity to it. Secondly, if you've had the infection already, they're still recommending getting the vaccine, both the first and second shot. You and I both had COVID before we got our vaccines. The vaccination, actually, you make the mRNA, you make the spike protein and antibodies in much higher numbers than from the natural immunity. So
Right.
we both went ahead and got it. That's the recommendation.
Correct. Right now it looks, it's all about supply. So we just have to have better purchasing power as a state to get more doses, and the distribution, whether it's through Blue Shield, however they can operationalize it, who cares at this point, just get it out there.
Yep.
So my preference is that they also give it out to community doctors so that we know where our patients are. And then we have a lot of homebound patients, right, too, that aren't able to navigate a system like the LA County Department of Public Health website, and you know the underserved and the patients that can't, like I said, navigate a website and make an appointment for themselves. So getting it into the hands of community doctors would really help too.
All right, I like it.
All right.
Tickle that like button, subscribe,
Nice. Okay.
turn on the notifications, and yeah, we'll see you here next week. I don't know if I'll be here, but Dr. Ossick will be here.
Thank you, guys. Have a wonderful weekend. Bye.
Bye.